So what does it look like? Think about it. Now, it's looping back to all those physiological responses adrenaline does to us to take the blood away from all of our organs and make us into fighters or flighters. Headaches, stomach aches. These are the kids, right? In the morning or before the birthday party or before the test or before bed. Headaches, stomach aches, difficulty relaxing, having low energy, being depleted, sleep problems, not hungry, throwing up. Right? When you look at it from this model, it's pretty clear when you loop back to see that these are the natural responses to anxiety. Now, not always, right? Sometimes they're sick, but we're going to be looking at patterns. And then what do we get? Well, we often get very difficult behavior. Very difficult behavior to parent, very difficult behavior to teach in the classroom. Right? Avoidance. We're going to talk about avoidance tonight. Avoidance is the worry monster's best friend, right? The more you avoid, the stronger your worry and anxiety gets. It's that simple. We avoid what we don't like. If you're John Madden and you don't like to fly, you buy a big bus. Why would you not do that? If you don't like animals, you don't go to the zoo. If you're afraid of insects, you don't go camping. So we do this. This is a natural human response. It just gets in the way when we have to do regular life activities, like go to school, talk to people, take a risk, get in front of people. Often a lot of crying, meltdowns, disruptive behavior. This is the biggie. This is the biggie. Early on in my career, I think when I started to become passionate about anxiety was sitting at all of the school meetings after doing full comprehensive assessments of very difficult kids who were behavior issues and seen as having a behavior disorder, but they had anxiety, and this is how it was manifesting, because they couldn't articulate it, and they were afraid, and they were reacting, because their amygdala was overriding their frontal lobes. They weren't able to think, they were just acting and responding. You also get the nail biting, the excessive clinging, the did I do it right? Are you going to be okay? Am I going to be okay? And then sometimes when you see a child whose behavior just really changes suddenly, something's going on. Something's going on, right? As a parent or as a teacher, a caretaker, when the behavior changes, something could be going on and we want to try to get to the bottom of it.